It's Tuesday morning. The buyout is happening today. It's a little bit rainy, but you know what? It's a tropical rain. It's nice and warm. It's like 65 degrees out here. And the first trailer's here. We're getting the horses unloaded. Let's catch right in. Let's see what's going on. Let's get some horses saved today. All right, first horse coming off. Second horse coming off. Up to weight, a little bit, maybe a little older. And there's supposed to be two more. Let's sneak on in there and see. And I think there's one more. I think we had 4 coming out of this trailer. Alrighty. Come on, buddy. Let's hop off. You're at a safe place now. Come on, bud. Your friends are going to leave you. No, they're not. They're all safe. Come on, buddy. Let's get off the trailer. There you go. Good job. All right, so first 4 horses are here. First 4 horses are safe. Our vet team is ready to jump right in, start assessing and evaluating for the intake. Come on. So here they are, the first 4 to get in. And can't wait to see, hopefully all 4 of these go on to find homes. That would be absolutely amazing. From what I understand, they're not trained. Although that one's wearing a halter, so apparently has some halter training. And that one's also wearing a halter, so I don't know. I heard a story. We're gonna find out what the real story is. We're gonna get these horses the help that they need. Looks like Jordan's getting the first horse ready. It's just kind of a misty day today. A little rain coming down. Little rain never hurt nothing except for maybe a camera. So we're gonna have to keep the camera dry today, so we'll see how much we can do outside and how much we're stuck in the quarantine barn. Not real sure how halter trained any of these are, but Jordan's gonna find out here real quick. I'm guessing the ones wearing halters are gonna do just fine for him.
Okay, how far out is the other trailer?
Oh, I want the gray one.
So let's pull the gray and let's. I would love for these horses not to interact with the other horses in the company. Because then we've got a running path, it would make more sense to put them all the way down there. Pull the neuro one out and look at her. We just found out 2 of the horses are down in the trailer and the trailer is here. So these guys all look to be in okay shape. That gray looks neurologic, so we're gonna look at her, but I think we're gonna try to keep these guys from interacting with the horses that came through slaughter auctions. Consistent with an age of 14. I don't want to get anybody hurt. Haley, do you want to just like try a few steps? Like, we don't know if this horse is actually halter trained. Seems, yeah, okay. Why do you have blue on your leg? Okay, that's great.
I think the trailer had blue paint, so now the horse has some blue on her.
She's got a little spot above that right eye, looks pretty superficial. You're being very great. You're doing great. You're doing great. Good job.
So what are you saying with her?
So she just failed proprioceptive placing tests on both pelvic limbs. Neurologic disease is kind of an umbrella term. Might have to cut this short. Here comes the next trailer. So we know that this mare's brain doesn't know where her hind legs are in space. We don't know why. We need to do some more tests. She's only 14 years old. It is a concern. There are neurologic diseases of major concern for both humans and other animals. West Nile virus, EPM, rabies are all on our list. EPM is the most likely in this area, but I think what we're gonna need to do, I want to do a more thorough exam on her. She looks stable. Like, I don't think she's going to go down right now. I vote we push all of these horses all the way down there and process them last. There's hay down there. There's hay down there. Come on.
Getting these guys moved down. So when that trailer unloads, I think there's 20-ish on that trailer. And Keep going. 20.
22. Come on, guys. Come on. Come on.
They're not in a hurry today.
It's funny dealing with horses that aren't afraid of humans. Hi. Yeah, you're a good girl. Come on. I think she's vision impaired in both eyes. Good job, big girl. Can you see? You can see a little bit. We're going that way. Follow your friends. Haley, I'm going to push them all the way down.
Alrighty, here comes the first one off the trailer. Well, they had some horses down. Oh man, let's go see what's going on. Unfortunately, a couple of the horses fell down on the way here, and Haley's working on getting her. It's in a very bad angle.
Okay, Haley, hang on. Can we get another halter and lead rope, please? I need another halter and lead rope. Okay. Can I get a halter and lead rope? Yeah, okay. Come on. Hi, sweet girl. Okay. I'm sorry. Okay. Can I have 10 cc's of Banamine, please? Okay.
It's very, very sad when horses are down. Anytime they fall down in a trailer, it's just super sad.
Oh my goodness, those feet. Okay. Haley and Jordan, I'm gonna have you guys both get on the head. Okay, ready? Oh, you gotta pull the mane. Grab mane, yeah, ready? 1, 2, 3. Okay, let's do that again. Let's try to rotate. 1, 2, 3. There we go. Okay.
This horse is just gone. Like,
Doctor,
it's not gonna make it.
I don't have my
on board right
stethoscope
away.
on me either. Okay.
This is so incredibly heartbreaking.
Don't step on your
What the
friend.
slaughter
Easy.
pipeline does to horses.
Easy.
And the others are like, we want to get out of here.
Easy.
They're being very careful not to step on the one that's down.
Okay. There's one more.
Get him off when he's stuck in the gate.
Okay, Banamine's on board. Okay.
This is so heartbreaking.
Regina. Sorry, buddy. We got severe respiratory wheezes. Can I have a syringe of blood, please? I know, you're okay. Easy. I think we're gonna have to euthanize this horse where he is.
Maybe can't see.
He has had pain meds. We've got drugs. I know. Easy. Okay. I already gave him Banamine. Okay. Shh.
You want him to pull forward?
Okay.
You pull forward?
Can I have like 30 seconds?
30 seconds.
Yeah. Yeah.
All right, well. You know, you got no. Okay. Heart rate is in the 80s. Okay, I'm okay with the trailer being moved now.
Everybody's out of the trailer.
I think we might be able to get him sternal. Got bounding digital pulses in the left front.
This, folks, this is so heartbreaking.
Present but milder in the right front. Okay, sweet. Okay.
How
Oh,
old,
he's not that
Dr.
old.
Liddy?
He's not that old.
How old, Dr.
Maybe
Liddy?
12.
12, oh man, 12-year-old
Goodbye.
horse.
Okay.
Is that a bruise?
Yeah, it's a bruise. He's got an ulcer on his tongue. Okay.
So heartbreaking. So look at these feet. This horse has suffered so much neglect and abuse. Just unbelievable. Short life, just 12 years old. This poor horse. It's just so, like, the words fail me to accurately describe the emotions of seeing a horse that has to be literally pulled off the trailer that brought him here from the slaughter pipeline.
Yeah.
And
0.7 of butorphanol, please?
wow, just horrible condition. Like, has weight, but like the feet, like you saw, horrible feet. And our vets are going to do everything they can. I don't know what the outcome of this horse is going to be yet. What an amazing recovery if it can happen. We're going to have to find out. I'm going to throw these other horses some hay real quick because there's a pile out there, but not big enough. So hold on a second.
Write that down for me. That is going to be my official drug log for the day, so that would be great.
Like, yay, food. Ah, keep the camera recording. Ah, look at that throw. Woo. All right, got some hay over there for him. So look at this cute little pony with downright horrible legs. Legs aren't supposed to look like that. Poor pony. Ugh, so bad. Just so bad. So these are the other horses that came out of that trailer. And everyone's at least standing and eating. They're still helping the one that was down. And yeah, wow.
So these buyout days are always really tough. We got a report before the trailer got here that there were 2 horses down. One of the horses was in really horrible shape. He was only about 12 years old, but he was down in respiratory distress. His heart rate was severely elevated, and then with pain medication, it came down to be very low. He had a lot of fluid in both of his lungs, and then he had bounding digital pulses in both front feet with a severe slipper hoof. So poor guy was only 12 years old, but he was actively foundering and then had respiratory disease. He showed no indication that he wanted to get up. He responded really well to those pain meds and really relaxed into things, but we didn't even ask him to get up. We gave him the last act of kindness right where he was. His feet are just horrible. I think he's been in pain for a long time.
All right, vets are going to start working on this one. With the super bad legs, going to be getting some x-rays, I do believe I heard tell. And well, man, he's just looking for some grain. I want food.
There's 2 blind horses in this trailer.
Okay.
Alrighty, here comes the horses off this trailer. I can see the one at the back is super emaciated.
That was important. You just have to push them up and then have them pull forward a little bit.
Yeah, they're all really gentle. That red one right there is the blind.
Hi, guys. Easy, there's a gate right here. Easy.
First,
You want to pull them through, let them keep going.
No, just the red one. They're black.
Okay. Hi, sweet girl. Hi, can you keep walking? Good.
alrighty, number 3 coming off. And 4. There we go. It's not raining in the trailer. All right, number 5, big mule. Mule, donkey, mule.
That's just blind in one eye. That one that's left on there is completely blind.
Alrighty, so the one that's still on there is completely blind, so Haley's gonna go put a halter on him and hopefully lead him out. Coming out on his own. And getting some radiographs on the little mini with bad legs. Wait, what's this, Keith? What you got?
I have lunch.
Woohoo!
Got red boxes to number 3.
All right, pizza's arrived. Thanks to our donors who donate specifically for pizza. We super appreciate it.
Vegan.
So crawling over this panel is Dr. Lydia. She's going to try to get this blind horse out, separated by himself. He found the hay pretty quick. That's pretty cool. And
Look, easy.
it's another beautiful horse. Hi, buddy.
Easy, good boy.
And they're all just kind of grabbing some mouthfuls of food.
He is very cute. I think he needs one of his eyes removed.
Poor,
Can I smell it?
poor legs.
Someone wants to.
Haley.
Hi, you just, oh, my finger is not edible. I'll get you a pizza crust. How about that?
The shipper said that he or she. That other little mini is weight bearing. So maybe we have a fractured leg.
So looking at his radiographs of his left front, he definitely had fractures that have collapsed the joint. This one's more impressive to look at. You see all that proliferative bone. And then his right front, that's down by the fetlock, and he's got a splint bone that's way out there. That's the angle of the fetlock. It's really out of whack. And then look at the increased joint spaces and also collapse all through the right front.
So just general diagnostic.
He definitely had a left front carpal fracture, and because of that, his right front was probably the compensatory leg, and it's caused the right limb to break down.
Caitlin got very happy when she saw the pizza.
I'm a pregnant lady. You like food.
Dr. Lydia is evaluating this horse. And that's one of the blind ones, right? Yeah. Yep. One of the blind ones. Dr. Gina's busy evaluating this horse, very skinny, male. And Emily's scanning for a microchip.
There you go, cute
I didn't
pony.
hear beep, so probably no microchip. Alrighty, getting x-rays going on here real soon.
Hi, friends. Hi, you so sweet. Hi. Hi. Okay. Hi. You're being super sweet. You want to be next? All right, friend. Can you get this gate behind me?
I'm going to try my best.
Okay. Oh my goodness. 0.5 of Dorm, IV.
He does have a cut on his little eye.
Guy's got
If you're not wearing lead, please make sure you're 10 feet away.
hanging above his eye.
Hi, sweet thing. was very polite.
Justin's filming. X-rays are being taken. Dr. Gina's going to diagnose what's going on here.
Gelding. I would say he looks like a Arab, maybe an Arab cross.
Yeah.
Very sweet and easy to catch. I can't read that auction number.
Heart and lungs sound okay?
So far, yes. I would not say that I got a great auscultation. I can confirm that this is a male, and I don't see testicles, but yeah, it's a little bit puffy. Looks like recent trauma, though. Buddy, you very sweet. Thank you, Jordan. He's the right size for it.
Not the super strong Arabian face, but his eyes and stuff.
I do not see any indications that he is intact.
Arabian gelding. How old?
20.
Which is young for an Arab, sort of.
It's a baby.
Should
Middle
we
age.
float your teeth today?
Hold on, let me grab a picture during that.
An Arab wearing a cowboy hat.
He's not too thrilled.
Yeah.
There. If you want to go back to that angle.
Yeah. Should we pop an ultrasound on? I'm curious if we've got a complete soft tissue avulsion happening up here, like joint capsule.
Maybe, but he's got,
It's got joint collapse.
yeah, like look at all
Ooh.
that there. There. There's some down there.
Yeah. He's not,
He doesn't bear much weight on it when he's alert.
yeah.
Um,
Poor buddy.
So they just got x-rays and they're diagnosing on this horse. The poor guy. Doesn't seem like he's doing great. So what's he got going on?
He unfortunately has at least one, but possibly two fractures associated with the hock joint that's very warm and enlarged. He responded to pain medication, but he's still not fully weight bearing on that leg. He's very sedated right now, in addition to pain meds, but he's got bony changes, but also soft tissue changes.
This guy passed the initial assessment intake, and Dr. Lydia is going to float his teeth later. Right now we're just getting all the horses taken care of, and he's going to get a tag and head on out to a holding, and over the next week or so he'll be getting his teeth floated and some other things, but he's doing all right. He's getting the stuff he needs done so he can go out in the holding pen. All right, which horse is going to be next? We've got a bunch of horses.
Hi, you very sweet. How about you, tiny thing? Just trying to see if anybody wants to volunteer to be cooperative. Hi, you're a super cute color. Hi. Is anybody halter broken? Sure, if you want to walk down there, we'll put you in the chute. Hi. Nope, it's a hard no. All right. That is totally fine. You guys go out there, and I'm going to shut this little monkey in here by himself. Perfect. We've got a horse.
Haley is going to try to catch the little guy,
Just put him in this
and
and right behind this barn.
little guy knows how to stay away.
Yeah.
So they're all at the end. I can shut the middle off.
We really need those horses up here.
And just like that, little Minnie's caught. And cute little Minnie, just horrible leg issues. Getting a little mini halter on. Oh, it's so cute.
Yes.
Oh,
96,
You're doing better,
okay.
buddy.
What color is that?
What does this horse need? I'm going to touch you. Okay, good boy. Good boy. Very good. Yeah.
So this horse is unfortunately completely blind. And
Sweet thing. Yeah, as stressful as the slaughter pipeline is, imagine doing it not being able to see anything. You're a good boy. I'm gonna put this halter on. Have you ever been in a halter? Okay, yeah.
he hasn't offered to do anything bad yet.
Good boy. This horse is about 18. He's a gelding. He's completely blind in both eyes. He's got some entropion where the lids are rolling in and causing irritation, but he's not to the level of this eye could rupture at any moment emergency. So he does need both eyes surgically removed. He doesn't have a heart murmur. His lung sounds okay. Very concerned about his body condition score. He's quite thin, and he's been running into things a lot, but it's really difficult to say if horses are well adjusted as being blind or not. So my plan for him is to put him somewhere safe, evaluate his teeth under sedation, and see if he's got teeth, if we can get him to start gaining weight. And as soon as he's a better surgical candidate, then we can evaluate. It's a big surgery to remove both of those eyes, and because he's not on fire, painful in those eyes, we have a little bit of time to wait with scheduling that surgery.
Aw, the cute little guy. So he's definitely trained to lead. So
Yeah,
it's part of the evaluation
it's a good
process.
boy. What you got?
See if he backs. Oh, photo time. Okay. It's always interesting how blind horses walk. They kind of try to feel before they step down and commit. And he's doing okay though.
Can you kind of walk him around out there and just get him more comfortable to moving?
Honestly, he's so small, you guys. I would do a
Straight through.
yeah. I think he's small enough. If we bump our MA up, I think we can get a diagnostic pelvic image. Hi, don't kick me. I'm right behind you. He is being a good boy. He doesn't seem painful. Can you bend any of this? You got nothing. Can I have some clippers?
Buzz, buzz.
Dr. Lydia says we're going to ultrasound him. See what's going on in there.
Is that scary? You're being a very good baby. I'm sorry.
Did we figure out how old he is?
He's 3.
Oh, 3 years old. Wow.
Yeah, he is not sedated. He's being a very good baby. He's a little concerned his respiratory rate went up, but I don't want to miss something that's causing him pain with every step and not address it.
This is his right,
Yeah.
and that's his left.
Oh, sorry, bud.
So what are you seeing?
His patellas are 2 different shapes. So this little bone, it's like a little sesamoid that glides inside of your knee joint to help you do the whole bending your knee position. And this is this affected limb. It's very flat and long.
Can we take a hawk rad too?
And this is the right, and it's a normal shape.
This joint should be able to close and this joint should be able to close. And he cannot move either of those joints. So our problem is either here, or both. But it seems very static. He's definitely going to get arthritis, but if his job is going to be to look cute and eat treats in someone's yard, then... All right, so I would love a hawk rad set. It helps us see when we're trying to look at tendons and ligaments. It just kind of offsets things and it gives us a better quality image. And I don't know why I'm doing this because Dr. Gina is our ultrasound guru and is way better than I am at it. know, bud.
You're looking so good.
There's bone.
Yep, there's bone. So this is our tendon sheath. And I'm just going to try to follow this guy down. There's some roughening. I have a little bit more gel. You okay, Caitlin?
Yeah, I just gotta sit.
So again, here's bone. Here's our tendon sheath, and we're running down. Got something right there. That is right underneath that patella.
Looks like there's little pockets of fluid too. I mean,
Yep.
some is normal, but
That right there is right here. I'm gonna go right over that. I love this ultrasound so much. Man, so I don't know if you can tell how hard I'm pushing. This takes a lot more physical force than you would think, but this ultrasound is incredible. Ella.
yeah, and the fibers are not congruent, not all going the same direction. Some
Yeah.
of them are pretty skitty scattered.
Skitty scattered.
Congruent. They're not uniform. They are very like. Which usually indicates injury.
Here's our lesion, Dr. Gina. See that from the outside? See how it pops
Yeah.
over?
Ugh.
Yeah.
What, the central?
But he doesn't seem painful, right? Was he reactive to that at all? All right, cool.
His nuggets are
Cool.
firm and in the same spot.
Um,
My turn.
great. So let's do full intake on him. And let's find a safe place for him to be that's not where he's going to have to compete for resources with bigger friends. Haley.
He has burrs. Brush them out.
Okay. Yay. I love our ultrasound. First needs vaccines, microchip, dewormer.
Okay.
Okay.
He's been warmed, that's it.
Okay, he also needs all of the things, and he is old enough to have regular vaccines. Tawny, what's our next horse? This guy? Okay. Sorry, Jason. Hi, cutie pie. Hi.
Where did you put the saran wrap?
It's in my pocket. Thank you very much. Just, will you make sure, what we want to make sure of is that nothing gets up in there, because that's what affects the image quality.
I get to hold this horse.
I would just put him in the stall for now,
Well, they're doing everything to him.
after they do everything. I'm gonna go get pictures of the other.
We could put him in the vet hospital
Yeah,
if we don't have another spot for him.
that would be good.
Hi, are you good for pokes?
After
You look
we get
like a
everything, I guess
baby.
you could just
Do you have a baby face or are you an actual baby?
15. I could be totally wrong.
Hi.
He has the 8-year-old hook on this side though.
I don't see any of Galvani's groove. So I like 10. I would go with 10. Yeah, you might only be 8, but we'll call you 10. Are you comfortable if I poke
Yeah.
him? Okay.
As long as you're comfortable, I let go of him if he pulls back too
Yeah,
hard.
do it. You're all right. Okay, okay. Yeah, you're fine. That was not so bad. Okay, yeah. Guys, I think that Minnie's gonna be adoptable. He's gonna be a gimp his whole life, but that's okay. We just need to make sure whoever adopts him knows they cannot let him be fat.
Yes.
Hi, okay, I won't mess with your mouth too much. Hi, I'm gonna come in here, okay? Hi. That's very nice. Hello. Easy. I'm not gonna mess with your face. Okay. Okay. Easy.
And this is the next horse. Dr. Lady is
Good boy.
looking at him, getting to know him.
You good boy. Okay.
So he's got a brand. He's a branded Mustang off the range. So not sure yet if he's a stallion or a gelding.
Started working here in January.
04. 04?
So he is 20.
He's 20.
Yep.
He's right at 20 years old, born in 2004. So right on. Hopefully he's a gelding, because stallions at 20 years old don't usually do very well. Just simply because the gelding procedure doesn't work as well as it should, and they don't aren't able to have as good of a life if they're a stallion and they're older. So anyway, we're gonna find out. So how's this Mustang doing, Dr. Lydia?
He's doing really great. He's 20 years old. He's been very pleasant to work around. I'm not sure how he'll appreciate being poked a bunch of times, but we're about to find out. I'm gonna save our strangles for last. Hi, handsome boy. I'm gonna poke you a couple times, okay? You're a good boy. Very good, okay. It's not so bad. Okay, I'm gonna poke you several more times. Good boy, you're doing great. He's being really great. Here, Haley. May the force be with you. Caitlin, would it be annoying to have you hand me a tube of Quest Plus? Thank you.
You have to do it to that horse.
Mark that really well.
Oh, Haley, good job.
Wow, he did really good for his
job.
shingles vaccine. Most horses do
He
not
really
like something
did. That
going
was
up their nose.
fantastic.
And his warmer?
Okay.
Wow, what a champ. This horse coming in is number 500 horse through the buyout this year.
Are these the group
Number 500 right here, buyout. Thanks only to your donations and donations from people just like you. If you think your donation doesn't make a difference, your donation made a huge difference. 500 horses.
Yes, they're at the back.
We're not done today yet. We're going to hit like 520 or something today. Maybe 510, whatever it is, but number 500 for the year is right there. Hello there, number 500. What a handsome looking horse.
Easy.
So I just want to poke the camera out into the rain for just a second. You see that guy up there on the roof? Yeah, they're finishing up the roof on the quarantine barn and the intake barn. And hopefully for the next buyout, we're in that building looking over at the one we're in right now. But they're out there working in the rain on the roof. I feel sorry for them. That's pretty rough up there. Nice little number 500 right here. Not the easiest going horse.
Sedated, dental, and prey check.
Of course, we all know Haley doesn't mind the rain at all. Haley likes the rain. It doesn't rain where she's from, so she likes the rain.
Haley, she needs a couple more pokes and then she'll be ready to turn out. She's got good feet. So Tani, you just let us know. Whoa, look at that right hind.
That's the one that was down the trailer, isn't it?
No, this one's
Hi. You're super lovely. Hi.
All right, trying to get some of the mud off to get some accurate radiographs. And be good to find out, is the damage and the injury severe and life-threatening, or is it just something that can be mitigated and treated? So we're gonna find out. Who's this from?
This is this horse right here. And what we were looking for was white blood count elevation, which we do not see. All of these findings are pretty much within normal limits. So I am not going to give him a shot of antibiotics. We're just gonna keep a close eye on him and turn him out.
Alrighty, hey, you're doing all right, buddy. That's cool. And this horse is getting put out into the 10-acre pasture. And lots of greenery, a natural pond, just a nice big place to spend quarantine. Not sure where Haley's going with him, but she'll let him loose here eventually. There he goes.
She is not sedated. I have not sedated her.
Alrighty, trying to.
Haley, do you think we should sedate her? Okay, you got it.
Gonna sedate her. She needs some sedation, so she's
Pretty gnarly.
much more comfortable. Alrighty, gonna be getting some x-rays on this horse.
Ready? And then if this... Ah!
Yeah, that's in the bone, in the joint
Oh my goodness.
too. Ma'am, she's moving.
Yeah. Holy
I don't know if
moly.
that's gonna be blurred or not, but.
It's all right. I mean, it's
Yeah,
catastrophic.
Yeah,
Poor
that's-
thing.
that's bone indentation.
Yeah, this is full on osteomyelitis. Yikes.
Why is it
So moth-eaten, right? So the infection entered from this side, but look, it is the entire area is just, this poor girl. Do you want to see this? So this is what a normal joint looks like, nice and crisp. This bone should only extend right here. This bone should only extend right here, and all of this kind of moth-eaten, spongy-looking appearance is characteristic of a severe bone infection. And this is our tract, right? Like this is where that injury was that's entered here, but all of this is bony pathology, and it's extending up her leg. She's quite painful on that leg, so abscesses can be really, really painful, and I'm always hopeful that it's just an abscess, but I don't think there's literally anything we can do for this mare. Hi, big girl.
So this is one big horse.
Good girl.
So this was one of the bigger horses we've had today. And how tall is she there, Haley, you reckon? Yeah, nice and tall, about 17, Haley thinks.
Okay.
And
She goes with anybody else who
she's
needs a sedated dental.
almost 6 foot tall, almost at the withers. So pretty impressive horse right there.
Oh, that's wonderful.
All right, Dr. Lydia says he's about 5 years old, so that's pretty awesome.
Very good boy. You're okay. Stud, 100%. You're a very sweet boy. You're not going to love what I'm going to do to you this week. It's going to happen. Let's and do other things while he's under for castration, which I believe I see both testicles. You want me to walk him? Hi, are you halter broke? You want to walk a little bit? He's a good boy. All right, you stay in here. Good boy. Not sure how actually broke this horse is. Let's microchip him and let's 5-way because I want that on board before castration. Jordan, let's just do him in here, and actually, like, we could just keep him physically here if we need to. We've castrated things that looked way worse than this. Yeah. He's got a great personality. He's already halter broken.
And he's only 5, so.
And he's 5. So let's pull blood for Coggins. And if it's possible, if we castrate him while Elijah's here, then Elijah could work on correcting his feet while he's under.
The sun almost came out. Almost. I was hoping it was. I saw some shadows briefly, and I got so excited because I thought it was going to get sunny, and I might have seen a rainbow, and now it seems like it's not going to be sunny. But it's sunny in our hearts because we've saved so many horses today. Like, I believe the final count is 27. Could be 26, 27, something like that. I'm going to try to get the final count for you before I have to go start editing this episode of the Almost Live intake. But it's been a good day so far. Heartbreaking, but there's been really cool things too, like this funny little stallion. Like, he's kind of built funny, but he's a sweetheart, and he's only 5 years old. So, yep, it's been a good day so far.
She sure is. She's got a brand.
Oh, that's a little Mustang. How cute. Did you get an age on her? Sorry.
I have not looked in her mouth yet. I will in just a second.
Says 505. The Coggins.
I don't know that you're going to be able to read this without clipping it. And she does have shoes on all 4 of her feet. Little Mustang.
Looking to see if I can find anything. Oh.
I'll get you a picture of her brand. Hi, big girl. You got a much babier face than an 8.
A complete picture of it anyway.
What do you think about that? It's all right. Good girl.
If anyone is dating young brands, like I'm not getting those pictures, so you should go and
Thank you for reminding me. I got one brand picture on a horse you didn't get, and I will upload it.
Clean one.
put it into
Impressive.
Okay?
take things.
Got it.
15.
So, 9 years old.
5 years old.
It's a pointer. It's a whistle.
Based on her brand, she is 9, so we will need to repeat that, Coggins.
All right, we are moving right along here. We've got a lot of things going on, and one of those is something that Jason and I have to go to present some awards. And I think we're just presenting one award. Anyways, it's something we're doing outside of Horse Plus. So we're going to have to leave here soon. So if Jason's going to get this video out before we leave, he's going to have to head down and start editing. So we hope you've enjoyed this almost live video. I know, I think it's Macy. Yes. Macy has been up here filming, and Haley and Macy are twins, so I have to check. She is going to be continuing filming up here, and she will get everything that you're not going to see. So be sure you watch the regular video. And heading over to Macy.
So Jason has to go and edit this almost live for you guys, so I'm going to take over and film the rest for you.
That's right. I've got a 6 o'clock appointment in town, and so I have to go get this almost live assessment and intake edited. I might get it done, otherwise it's going to be out late tonight, but Macy's going to be doing the rest of the filming, and it should be in the regular episodes. So I'm going to just catch up with Dr. Lydia really quick, and then I've got to run down and start editing like crazy.
We had
26 or 27.
6 or 27 horses come in. We've looked at probably half of them. We had a really hard start to our morning with a horse that was down that we had to euthanize in place. And we've had a couple other really heartbreaking cases, some with fractures and some with a lot of pain, but we've also had a lot of young horses, a lot of ones with problems that we think we can treat. So I'm hopeful that we're going to have a lot of adoptable animals from this group. We still have a lot to go, but we got our work cut out for us. Our surgery list is stacking up, which always makes me excited. And it's been an oddly peaceful day. I feel like sometimes intakes get pretty chaotic. Maybe it's the fog and rain, but we still have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 horses that we haven't looked at out of 24. So
26, 27, whatever it was.
Yeah, I lost track. But we're gonna keep rolling as long as we can see accurately enough to do our job. Our one little tiny bar light in here is not gonna cut it when it actually gets dark. So we'll finish up tomorrow, whatever we don't get done today.
Another Mustang.